Hello, I am Dr. Sandeep, Director for Radiology and Imaging Sciences at Tenet Diagnostics. Now, Tenet is a group of multi-specialty diagnostics which is spread over Andhra Pradesh, Telangana and Karnataka. We are capable of handling a whole gamut of investigations from radiology to pathology to microbiology and biochemistry. We are the leaders in high-end advanced imaging, especially with equipment such as the 3 Tesla Skyra 48 channel system, which is capable of very fast imaging and very accurate diagnosis. Very few systems in the country are of this caliber, and the advantage being a faster imaging and faster diagnosis. An area which is troubling most of us in the current day is viral diseases. Now we are all aware that the viral season starts from the monsoons and continues till the winter and subsides only at the onset of summer. Now these can be varying, the symptoms can be varying, and very often we do not have a clear-cut answer with blood tests only on what the exact viral etiology is, and these quite often need also some advanced imaging such as the CT scan. Now I am going to stress on the fact that the CT scan can possibly give you an answer on what you're suffering from. You may not be having the typical severity in the cough and temperature and the fever, but then deep down there may be an indication or there may be a lurking pneumonia which has to be identified. Now the routine chest x-rays, which most of us are accustomed to, cannot detect the entirety, and these being a single dimensional systems will have a lot of hidden areas, especially those areas which are behind the heart, which cannot be seen on the chest x-ray. Now these areas very often do need 3D imaging, which is provided by the high resolution CT scan of the lungs. Now the advantages of the high resolution CT scan of the lungs is that it is fast, and within a single breath hold your entire lung can be covered. It is accurate. We can actually document what you are having, what is the cause for your pneumonia, whether it is viral or bacterial, so that it gives an insight to your physician on whether he has to give you antibiotics, which is most often the case with bacterial diseases, or whether they have to institute antiviral therapy, which is most often the case with viral etiology. Now the recent epidemic has caused a lot of panic in most of our societies, and most of these can be avoided by the simple fact that we have to get a CT chest done, and the CT chest can give us a fairly good and accurate, reliable diagnosis on what we are suffering from and to the extent of what the lung disease is, depending on which the consultant and the physician can take a call on whether you need a simple home care with a little bit of a supplementary antibiotics to take care of it and the vitamins, or whether you need institutional care in terms of having you in a hospital setup with the coverage of all the necessary physicians and the specialists. So this can make a lot of difference, especially in the early stage of the disease, where you are able to identify to what extent the disease is, and then try and institute prompt treatment so that you can avoid unnecessary complications, unnecessary expenditure, and a whole lot of anxiety at a later stage. So the CT scan is an important tool in the diagnosis and management of the viral diseases, which are quite prevalent at least in this part of India. Thank you.